Joining us is Dr. Lisa Shulman, neurologist at the University of Maryland Medical Center and professor of neurology at the University of Maryland School of Medicine. Doctor, thank you so much for joining us. We're learning more about a link between hearing loss and dementia. What does the research say about that?
Yeah, it's a pleasure to be with you, Jeff. There really is an abundance of scientific evidence that people who have age-related hearing loss are at higher risk for memory problems and dementia. We know that it not only increases the risk of these problems, but that when things are done to treat that, such as using hearing restorative devices like hearing aids or cochlear implants, you can reduce the risk. So it's a very convincing story.
What are the possible mechanisms behind that link, that connection?
It's really fascinating because we don't have a total understanding of it, but we do have a lot of new clues to that. I mean, for one thing, if you can't hear well, a lot of your brain is busy trying to put in listening effort to make sure that so much effort is put into listening that you can't use all of your brain for the thinking process of what you would normally want to be cognitively engaging with. But there's also a lot of important information about how the lack of stimulation to the auditory pathways of the brain causes atrophy and damage over time. The interesting part is that age-related hearing loss is an aging process of the inner ear. And so the less you can hear, the less the auditory nerve and then on into the neural pathways in the brain are being stimulated. And those pathways begin to weaken just the way other parts of the brain might weaken when you are unable to use them.
Are people sometimes slow to either recognize or admit that their hearing is starting to go?
Very much so, and that is a real problem, and that's why I think it's valuable for people to know that it has more serious consequences than they might think. And another problem is that because they're they're reluctant to go in for an assessment and then for care, that they delay utilizing hearing devices like hearing aids. In fact, the adherence to people, even when they get hearing aids, is relatively poor. So there are a lot of reasons why we need to get the word out to get assessments and to get treatment.
Good argument for Medicare coverage of hearing aids, which I don't believe is the case.
Yeah. You're very informed. You're exactly right that Medicare does not cover hearing aids. It covers cochlear implants. Cochlear implants are also important for us to all know about because when people have more advanced age-related hearing loss, moderate to profound hearing loss, where they're having increasing difficulties understanding speech around them, the cochlear implant also should be considered in terms of the best possible management.
So much is being learned about the pathology of various types of dementia, including Alzheimer's. I'm just worried that somebody's going to be watching us and will feel guilty that they didn't get themselves a hearing aid in time when there are so many other potential chemical factors at work. There could be family history, genetics, could be vascular. How do you think about that?
Well, in terms of hearing loss, age-related hearing loss, it's fairly incredible that when studies are done looking at all of the potentially modifiable factors for hearing loss over time and hearing loss that results in cognitive impairment and dementia, the top one that would have the greatest impact is age-related hearing loss. Has a greater impact, it has been shown, than many other factors, such as hypertension, obesity, diabetes. Many other factors can have an impact and cause dementia, but hearing loss has the greatest impact in terms of something that is reversible.
And I know you're not an expert on which hearing aid does what, but generally there's a range of options now. There's over-the-counter stuff. There's super expensive, cutting-edge, artificial intelligence-driven hearing aids. Would you suspect that anything that's going to help you hear is going to potentially help with the processes that we're talking about?
No, I am aware that, and I'm a neurologist, not an audiologist or a ENT doctor, but I am aware that none of these options are perfect. They don't duplicate exactly the kinds of sound that we are used to hearing, but people who use them regularly do become adapted and accommodated to them. And the main thing is to continue to be able to communicate and connect with our environment, because it's sort of like a cascade or a domino effect when people cannot participate, and therefore they become increasingly socially isolated, which, as you know, is now understood as yet another detrimental effect.
Other ways to prevent or stay away from social isolation. I mean, we want to be in, if hearing's an issue, you want to be in a situation that's maybe a smaller group of people, maybe it's a quiet room, not the ballpark. I mean, what else might make sense?
I know I talk a lot to my patients about the importance of being an effective self-manager. And so, to be an effective self-manager, you need to be a good observer about what conditions work best for you and to avoid those conditions that are going to make it frustrating and difficult to participate and to engage with other people. So, I think that that's part of having virtually any health condition, is understanding the kinds of conditions that work best for you and to do your best to embrace those.
All right, so the big takeaways on hearing and dementia. Number one, there's a link and there's no doubt about it, would you say?
Oh no, there's absolutely no doubt about it. I mean, there's so many studies, big studies, studies that have been and we're talking about involving more than 100,000 people, some of these studies. And so they're very high quality studies. I myself am involved in an NIH-funded study where we are comparing hearing aids to cochlear implants in people with age-related hearing loss and seeing if we can delay and prevent cognitive impairment. So there's increasing interest in what we can do to reduce the risk of dementia.
And the other big takeaways are that it's important to stay socially connected, and it's important to act as early as you reasonably can to deal with hearing loss.
Very good point, because there was a very recent paper that showed that even very mild hearing loss has an impact on the risk of dementia. And in fact, when you do imaging studies of the brain, you can actually show that certain areas of the brain in people who have even mild hearing loss are not as, the volume is reduced. So the effects begin quite early.
We were talking before the program about your medical practice, the people you see with different degrees of cognitive impairment, and the benefits of now having something that you can describe. What is the cutting edge there?
Well, I think that more and more people are now hearing that over the last 2 years or so, the FDA has approved new therapies for Alzheimer's disease, which is a huge deal because for years we had very little to offer. These therapies, which aren't necessarily easy to use because they're right now intravenous infusions and they're required every couple weeks. However, the big thing about them is that they fundamentally alter the mechanism involved in Alzheimer's disease dementia. As you may have heard, Alzheimer's disease is involved with having both plaques and tangles. Those plaques are made of amyloid, and these new intravenous infusion therapies actually break down the amyloid and virtually get rid of the amyloid in the brain. The result is a slowing down of the progression of cognitive decline. Now, it's not as robust as we'd like it to be. It's about a slowing down of about 30% over a period of 18 months, for example, in the trials, but it's still a huge step forward in the treatment of Alzheimer's disease.
How optimistic does that make you for the medium term and the long term?
You know, what happens in every field, and I've been working in neurology for a long time now, but when you have a breakthrough like this in a field, we saw this, for example, in multiple sclerosis decades ago. When you have a breakthrough, it is a huge motivator for research and the engine of research to turn their attention to this. And little by little, I would expect to see more and more progress and improvement.
Dr. Lisa Shulman joining us from the University of Maryland Medical Center. Doctor, we appreciate your time. Thank you very much.
It's my pleasure.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.